Okay, so let's get started since we've actually already gotten started. So welcome to this panel. My name is Danielle Dowdy, and I am an advisor with the Toronto Police Services Board. And I'm going to let the panelists introduce themselves, this very esteemed panel. And then we're going to get right into this discussion around identity and service delivery and how and lessons that we can learn from system responsiveness through COVID. So I'm going to first call on Professor Natalya Alonso to introduce herself.
Great, thank you so much, Danielle. Hello, everyone, and welcome to today's session. Thank you so much for joining us. I'm Natalya Alonso, and I'm an assistant professor at the University of Calgary in the Organizational Behavior and Human Resources Department at the Business School. I study socially disadvantaged groups at work, and I came to the study of police around 2017, 2018. After the emergence of Black Lives Matter, I was really interested in understanding how police officers were responding to these shifting public perceptions. And I've also done some research with emergency service providers as well, so more so on the medical side. And I'm really looking forward to bringing some of these observations to our conversation today.
Thank you so much, Natalya. Amanda Hoover, who's with the Durham Regional Police Service, if you could introduce yourself.
Hello, everyone. I'm sorry for my technical difficulties and the fact you're seeing real life happening in the background because I had to go and charge my phone. So I'm plugged into it. Anyways, I'm Amanda Hoover. I've been a police officer with Durham Regional Police Service. I'm in my 23rd year. I am currently a sergeant in the Central Cell Block, but I was recently awarded a position in the Community Safety Unit. So I will be going to my main component will be overseeing the Mental Health Unit. I'm really excited about that. I'm super passionate about harm reduction and trauma-informed care approach, and I really look forward to this discussion.
Thank you so much, Amanda. And April Starr, who's with Motorola Solutions, if you could introduce yourself.
Sure. Hi, everybody. My name is April Starr. I lead the experience research team at Motorola Solutions. Motorola provides communication and software to public safety agencies. So my team uses a human-centered design approach to solve problems with and for our public safety customers. For those that are not familiar, human-centered design emphasizes putting people, humans, at the center of these kinds of wicked problems and uses a variety of different approaches to understand the latent needs of people so that we can design better solutions.
Wonderful. And thank you all so much for agreeing to be on this panel. And I'm looking forward to a very interesting discussion. So I'm just going to kind of go over the synopsis that we had that was posted on the website and just and start from there. And so COVID-19 has been the global pandemic of our time. When the virus began to spread around the world, local governments, scientists, researchers, epidemiologists, etc., they all began to craft their responses to understand the virus, its effects, and how to contain it. Responses have been varied from country to country, but what's been consistent has been the local understanding and action around the urgency of the problem and the ways in which systems had to become more flexible and nimble in responding to what the data was showing us. So this all begs a very important question. What could community safety look like for public health issues such as gun violence, traffic safety, human trafficking, to name a few, if our systems were able to respond as quickly and as effectively and collaboratively as we've seen over the last year? And what would this look like? It's been said that the failure of our systems is that they work in silos and are bogged down in bureaucratic policies, procedures, and red tape. They are structurally set up to have slow responses to dynamic community safety issues. So what is the hindrance in all of our government and community institutions working together from end to end? Is it institutional identities and cultures? Is it narrow thinking along service delivery models? Is it a deferral to expertise at the expense of true collaboration? And of course, this leads to the question about norms and values and myths within the institutions that are entrusted in caring for our most vulnerable, and how these services are able to perform, and how the identities that they have may create unintended barriers to integrated practice. So that's a big one. So let's unpack all of this, and let's start with the concept of identity. So in my Google research, I found a definition of organizational identification, and it was defined as a key concept in organizational psychology that refers to the degree in which employees define themselves as members of an organization and to what extent they experience a sense of oneness with it, its values, its brands, its methods, thinking, etc. So let's start with identity. And tell me, what does the term identity mean to you? And we can start with April.
Oh, we're going to start with me. Okay. I mean, I think from, I come from a design perspective, so identity is very much sort of how you express your beliefs, who you choose to align with, your capacity to change and evolve based on your beliefs and values.
Okay. I think Natalya.
Yeah, so in the literature, we typically think about, I guess, identity to me is multifaceted. There's many sources of identity. And I think, Danielle, you just brought up organizational identity as kind of one way that we can define ourselves. But I think across all of these definitions is an understanding that identity are the self-referential meanings, how we believe, how we see and think of ourselves. I think when we're thinking about policing and the healthcare industry, what comes to mind for me is really occupational identity. And how that's defined in the literature is kind of the answer to the question, who we are and what we do. I think what's important about that construct is that occupational identity really defines what it means to be a good occupational member. So a good police officer or a good healthcare provider. And what I saw in my own data collection, as well as other studies, is that oftentimes when we're talking about this adaptability and being nimble, occupational identity at least, doesn't shift as quickly as the conditions that occupational members are responding to. And so that's where at least I've seen things can become misaligned, because there is that underlying notion that identity, we typically think of it as enduring and stable. So when we think about things like COVID and the need to change so quickly, how do we kind of bring some of that adaptability into something that is typically a lot more long-term?
So much to unpack right there. We're gonna come back to that. Amanda.
That's a hard one to follow. Thank you, Natalya. For me, I find identity in regards to policing. Identity is twofold because me as Amanda Hoover, I have a lot of facets to me. Then there's police culture, which is part of, as you're talking about organizational identity. Police culture is, we could talk for a long time about that, and that's not what the conversation is about. But being a police officer and having your own identity, but also having to fit into the policing culture identity are two very different things. I don't know if that's really answering it, but there are two very different components of being a police officer. It's bringing yourself and everything that you are into the policing culture, and the identity as just a police officer as a whole, and how the police officers are perceived as a whole.
So just along this vein around identities and individual identity versus organizational identities, what are the ways in which law enforcement and public health intersect, but from kind of system identity level, but also individuals who work within those systems trying to align their work? what could be said about that that tension that's created sometimes? Natalya, I'll start with you.
So I think if you're asking about kind of the intersection between healthcare identities and the identities of police officers, and I think, Amanda, you brought up a really interesting point about personal identity too, how we think about ourselves as people in these roles that also have identities associated with it. So I guess the similarities or intersections that I personally see between the healthcare and policing identities, there's multiple, but I think something that really came up repeatedly in my conversations with police officers was the desire to help people. And I think that's something that is really shared across these different occupations. And so I think the identities associated with that are very clearly defined and articulated as well. They're very, they're what we call strong identities. If you think about a police officer and what a good police officer looks like, it comes to mind really quickly. And I think similar with healthcare, because there is such a responsibility associated with these different roles. So yeah, so I think there's those shared elements, definitely.
I think related to that, you know, I think they both share empathy burnout. And that's, I think, a big challenge as they try to, you know, serve who they're supposed to serve. And sometimes that, you know, that burnout is a real prevention to change and evolving. Right? Healthcare isn't moving as quickly as maybe we would like it to. Same with police service.
Thank you. And Amanda?
I was going to say that April just brought up a really important point. Actually, both of you did. So there is the desire as a police officer and a healthcare provider in public health to always be helping, to be the best you can be for the person you're working with at that time. But then when April's talking about the empathy burnout, unfortunately, in both fields, there are times when you're dealing with the same person repeatedly, sometimes in the same day. And depending on how you're wired individually, you can get super frustrated at why am I seeing you again? Or frustrated at why can't I help you? Or the system, I guess in air quotes, isn't providing me with the resources to help you. I think there's a lot of commonality in that in both fields, that the majority of us really want to help people. And there's a lot of things that are in play that often hinder us helping, be it the individual we're working with, the individual we're interacting with, the resources, the services that are available. Especially you mentioned COVID has put a lot of restrictions in place, which then can lead back to burnout as well in both of our fields, empathy and just being tired and fatigue and constantly having to say no or not being able to do what we really want to do when we're trying to help people.
Yeah, that's.
Go ahead.
Sorry. I was just going to say, following up on that, that's really interesting. That's something I was thinking about as well, in that I think both the healthcare profession and police officers are somewhat in a position, or perceive themselves to be in a position of being somewhat reactive to this society's problems, essentially, right? And I think sometimes that can hinder both professions from seeing the ways that they might be able to help address some of those societal issues up front versus on the back end. Yeah, so that's definitely something that came up in my studies as well.
I just want to spend a little bit of time on this idea about helping and what that really means, right? And how, as an individual within a system, within an organization, you know, might have an understanding of what help means before joining that institution, might have, you know, personal desires and passions and their own definition of what help looks like, and how that can get when that meets up with the system itself, right? Because the system as an entity, as a corporation, as cultural norms and practices, sometimes there are, you know, all of the red tape that we hear about. There's liabilities and there's laws and things to consider, and sometimes that ability for someone to help actually ends up going against the actual systems that are in place. So how does one navigate that? I'll leave it open.
Okay, I'll speak quickly towards that one. When you're talking, you brought up risk. Risk and liability is a huge component in my role, and also I believe it would be in the public health world. We're bound by mandates, by policies, by procedures, by law to follow. We have a lot of things we have to follow regulatory. And then you put the humanity in. So that comes back to my identity as Amanda and my harm reduction beliefs and feelings and trauma-informed approach, as opposed to an enforcement-based approach, leads to a lot of issues. And then issues is a big word that isn't necessarily what I'm trying to say. But going back to identity, as police officers operating and public health officials and members operating under all the different regulatory boards we have and mandates and internal directives and policies, that can be really difficult to navigate sometimes while wanting to help someone.
April?
I was just to build on that. I think, these systems sometimes, really inhibit the ability to do what you're tasked with doing. In our work, we see a ton of workarounds, some gray areas where people are trying to get around those boundaries because it actually is a barrier to the goal they're trying to achieve. And, I think, again, from a design perspective, we believe really strongly in flexible frameworks. So we believe actually in allowing for some gray area. And, I guess, with policy and with, liability and rules and restrictions, you can't have a lot of flexibility. So it's difficult to change and evolve if you don't have any flexibility to do so.
Natalya, if you wanted to.
Yeah, I guess bringing up workarounds, one of the, concerns that I have about workarounds when we're talking about risk and liability and kind of where that risk and liability stands. And I think one of the issues or concerns around using these workarounds is that the individuals that are driving these workarounds then seem to be taking on all of the risk associated with those workarounds, right? So if the organization is kind of tacitly allowing this workaround without sanctioning it, but not supporting it, that kind of puts them in a position where they can wash their hands of it if it goes awry, or take credit for it if it works out well. And so I think when we're thinking about workarounds, I would want to think more about kind of how do we protect those people who are championing them, so that it's not all on them. And yeah.
And is it possible to champion someone who's identified a workaround if it's in direct contravention of a policy or a procedure or a law? How do systems kind of grapple with that piece? Because a lot of times policies and regulations, they're vetted through lawyers and they're tested in court, and so they're not there's a lot of work that goes into them, and so that's how they end up becoming so rigid. So I guess the question is, what is an organization to do to not discourage somebody who's trying to do the best, but still they don't want to necessarily put someone out there that ends up becoming a risk or a liability?
I just wanted to talk about we're talking about workarounds. Something that just came to my mind that is something that police officers do frequently is, let's say you have a person who's at risk, unsheltered, hungry. There are organizations that obviously offer meals. So you put someone in the back of your cruiser, a marked police vehicle, you're technically detaining them because they have no way to get out of that point. But if you're just trying to be a good person and you're taking them to go get that meal because it's on the other side of town, and then when you're talking about the liabilities and risks, you would be thinking in your head, well, if I get in an accident right now, I don't have this person under arrest in the back of my car, but I'm just really trying to do something good for them. And their feet are really sore. They don't want to walk. It's freezing cold out. So there's a lot of times in policing specific where you're trying to really do the right thing by someone, marginalized, unsheltered, just hungry, whatever it be, taking them to maybe their appointment they have because they're going to miss it, like a probation officer or just with a community resource. They're going to miss it if you can't, well, they're going to miss it if you don't get them there. So as a good person, as a good officer, you're trying to help them out, but then you're opening yourself to a lot of liability potentially, and complaints. We're governed by different organizations that oversee complaints. So there's a lot of times that hinder you just trying to be a really good person to help someone else out.
And I think what I'm picking up from Amanda's point is that oftentimes these workarounds are addressing a need that is required, or it's addressing a need, right? Something isn't working properly and it needs to be done differently. And so I guess when I think about how can organizations kind of support those individuals doing a workaround while changing, I think we need more upward voice mechanisms where basically the people on the ground, like Amanda, are able to articulate those issues up so that they are considered from a broader standpoint and they become solutions to solve in a more formal manner, instead of these kind of one-off workarounds that, like I said, end up putting that individual in a tough position sometimes.
Just to build on what Natalya said, which I just love, I love that idea that, rather than think of everything as top down, we can provide some bottom up thinking and allow for that. I think that's incredibly important because people are incredibly creative and can solve their own problems, and you want to actually foster that in some way, right? It's challenging, again, going back to how much flexibility do you really provide, but workarounds are indicators, to your point, Natalya, that there is an issue that's just not quite right and not working, and people are trying to find a solution for it. And so leadership should be looking at these workarounds, maybe not as the answer, but as a problem that they need to go solve or
So
learn more about. A lot of times I think there isn't enough learning and really unpacking what is going on. So I would encourage much more understanding about why that workaround exists. Sorry, go ahead, Danielle.
I was going to ask, so how would you classify the workaround? Does it become a part of the culture to find, like the organizational culture, to find a workaround, to work through workarounds because the system is so rigid? Or is the workaround a response to the systems that are in place that are not quite responsive? Like where does the workaround sit in our understanding about organizations, their systems, their cultures?
A lot of workarounds in my field, and I don't know for public health, but are reactionary to the rigid system. So you're trying to do the right thing, or perhaps the resources aren't there, or for whatever reason it is. A lot of officers do workarounds with the understanding, sometimes the knowledge that if something bad goes down, you're going to eat it. But at the time you're doing it for the right reasons, but it is in response to the rigidity of a lot of the governances we operate under.
Natalya, did you want to weigh in with
Yeah.
your research?
I guess one of the things that I've observed is that there seems to be sometimes almost a willful ignorance on the part of leadership, or what I call a decoupling between kind of the formal policies that are in place and the workarounds that are happening on the ground. So it was my perception that, people aren't doing these workarounds without anyone knowing about them. Everyone knows that these things are happening, but they're just completely divorced from the actual policies and procedures. And so I think that potentially does speak to this idea of just how embedded some of these workarounds are in the culture itself.
So what would be the hindrance to, and this is open for everyone, if you know, if everyone knows about the workaround and everyone kind of looks the other way, what is stopping the system from then looking at the issue that the workaround is trying to address and actually finding a solution to that piece? Like, will that change? Will that change anything? Will that change the system, or, you know, will another workaround pop up somewhere else because it'll uncover another thing?
I
I
mean,
don't know.
I can't speak for the public health side, but at least on the public safety side, you know, I think a lot of what drives it is just a fear of change, because these are huge systems and it's like playing whack-a-mole, where you change one thing in the system and then a few other things pop up. And right, these systems have huge impacts on society, and so people are just very concerned about making any changes for fear of having the whole thing unravel.
Which is a, you know, an interesting thought around how do, you know, workplace cultures and you know, organizational identities, how is change impeded by sometimes these very rigid things, whether it's the formal or the informal, you know, and what are, you know, what are some key ways in which you know, systems are not able to change because, you know, whether it's the systems that are in place or the organizational culture. I don't know if you want to take that one.
Oh, sorry,
Sorry,
I'll go quick. To me, that comes down to part of it. One of the issues is your own identity as a person again. So what's something I might want to do for a marginalized community, vulnerable people that I'm very passionate about? Another officer might not even see that as an issue because they may be more enforcement driven, more black and white, whereas I'm a lot more gray. So that's could be part of the problem right there, is that the humanity of the individuals within an organization, a culture, sometimes it's easier just to operate or under the way it always has been. So it depends who's also driving the changes and who has the biggest voice. And another part of that is also what we were talking about earlier, is everyone operating in silos. So it's not working together in partnership to have greater resources available, to have access to what we need to better serve the public in an easier way. So we wouldn't have to be doing the workarounds. We wouldn't have to be having a lot of these questions. It's breaking down the silos as well, and then dealing with individual members within both fields and their perception and how they deal with the marginalized community.
Natalya?
I just wanted to add, I mean, I think you touched on the kind of the formal aspects, but also the informal aspects. And that, in my view, has been one of the largest roadblocks to change that I've observed, is just what we call political tactics among lower level employees, things like rumors, pranks, jokes, these informal mechanisms that some employees use to kind of sanction other employees who are trying to change things and to devalue those efforts. I was quite surprised in some of the data collections that I've been involved with, just how much support there were for changes in the leadership level, at the leadership level, and how effectively those efforts were consistently cut down by lower level employees through these informal social tactics. So I think that's certainly an important factor, particularly as it comes to police.
And I think, Oh, sorry,
go ahead.
Danielle.
Go
I
ahead.
was just going to add to Danielle, I think, or sorry, Natalya, I think another, aspect of this is like, police officers are overwhelmed, and thankfully in the last year, the conversation has finally started, at least in the US, around we can't ask police officers to be everything to everyone, right? Something's got to give. And if somebody is proposing changes and people are overwhelmed, they're not going to want to change because they are barely handling what they can handle. And so I think we really need to think very intelligently about what the role of a police officer really is and what other roles should be there. Because there's never going to be a capacity to change if we don't give people sort of the space and freedom and incentives to make those changes.
That makes me think of the defund movement, and I know that's a very sexy term, and it means a lot, but when you unpack it, it sounds a lot like what you are describing, April. Like, how do we look at all of it's less a question about getting rid of police and taking away all their money, but more around looking at who's doing what and how services are delivered. And which kind of brings us to these kind of organization system changes within law enforcement and public health. So I guess one of my questions would be, what are some key elements for systemic change that we as a society writ large need to look at when talking about law enforcement and public health, where they intersect, and how kind of the workload can be better distributed.
I can speak to something my organization is doing that I think is really cool. In the new unit I'm going to, well, it's not a new unit, but the unit I'm going to, part of our mental health unit, we have mental health trained officers who are partnered up with mental health trained nurses. So that's public health and policing working together to go to the mental health calls. It streamlines it. You're actually having a professional, not just a police officer trying to be a mental health professional. You have a mental health nurse, trained nurse, who has access through the hospital system to the client's records to have a better understanding of that person and where they're at. And the unit is expanding to have be a unit of 11 now. We're also, within my organization, they're going to have a lead nurse in the emergency department who's going to facilitate if a person is brought in under mental health apprehension to make it as much a better, the best possible outcome it can be for the person with the least amount of touches is a weird word, but least amount of interaction with different agencies, different people if they are brought to the hospital. That's another way we're operating. And another thing that my organization is doing is looking at putting a crisis worker within our 911 center to be able to talk to people. Instead of it just being an automatic police response, the crisis worker can speak to the person for however long it takes and then determine if it's a police response or if they can recommend to other resources or other agencies. I just think that's something that my organization is doing that's more forward thinking, utilizing public health and people with the proper training to have a better outcome for the people that we're serving, especially those in mental health crisis.
That's good. April or Natalya, did you want to weigh in?
I'll just speak, from a tools perspective, right? Motorola, we make tools to help facilitate communication and sort of manage all of like the data and information that gets shared, across these various parties that are trying to work together. We're looking at so many different ways that we can help people collaborate differently. I've worked in other industries, and so, public safety is the furthest behind. I mean, if you looked at the tools that they have to use, it would shock you. So, we have, we have all this great technology, we have all this capacity to make great tools to help people collaborate, but again, like the willingness to change and evolve and be comfortable with new tools is sort of inhibiting some of that. But as we see agencies, like the one Amanda, works with, sort of expand that's going to force companies like us to make changes to our tools to help facilitate those workflows. And so I get really excited when I learn about these new models of response, and I think it's going to push the tool side and move it forward.
So so what I'm hearing is, as we look at the ways in which we can start to share this work and bring in, other agencies into this work of law enforcement, sometimes we hear politicians say that on the other side, on the community side, on the community organization and support side, those organizations aren't quite ready for this shift. So the public is asking for this shift, but is the infrastructure in place ready for this shift? Are community organizations that work with folks with mental health ready for, more calls? Do they have enough staff? Do the staff have enough training? Do they have, enough resources, enough funding, et cetera? And so I guess the question is how, are they ready for this, change, this kind of this large cultural change for the institution of policing and public health? And if they're not, what will it take for them to get there and to get ready? I don't know if you have any thoughts on that, Amanda, from what you've from your experience.
So I was just going to say, I don't have the answer to that, but I do chair the Coalition for Harm Reduction in my region, and there's, I believe it's 17 partner agencies. When you're talking about funding, and those are agencies, we're the only police agency, the rest are social service agencies, public health agencies, everyone who's working together to work with at-risk and marginalized communities. However, a lot of the times the topic centered when I'm doing the agency updates for the time, a lot of them are going after the same funding for their specific programs, but to help the same group of people. So I don't know the answer to the funding, but because that's not on my side, but I've heard the discussions around the table that I sit at, that there's not necessarily a large pool of funding for them. And each agency is looking for those grants. They're technically competing for those same grants and that same funding pool because they all have amazing programs that they're trying to offer, which would benefit the community at large, and which actually would take some of the responsibility off the police and make it less enforcement driven, as opposed to more of a social services, hospital medical services. That's gonna be a lot more beneficial to the person as opposed to repeated police contact.
I think the fear is like that, right, we're going to try these things and we're not going to have the resources and the whole system's going to kind of break and shut down. There's going to be all these problems. And so people want to be ready, but there is no perfect time to be ready for this. And, when, the way we work in human-centered design is really small scale prototyping. We will start very small. We will, try something out and then kind of sit back, talk about, did it work? What parts worked? What parts didn't? Think of new ideas, try it again, learn from that experience, try it again, start to scale it up slowly, larger and larger. And I feel like the, approaches that I've seen to address these issues, again, seem very sort of top down. They're not very iterative. It's not a cycle of learning and solutioning. It's just, we're going to sit in the room and figure out the answer, and then we're going to push it down. And I just don't think that that approach works for these kinds of problems.
Natalya, did you want to weigh in?
Yeah, and to that point, I think that's at least what I've observed in some organizations, is certainly these kind of pilot projects or little teams that are addressing these gaps. But from what I've heard from employees, at least, that it's just far too little. And on the other hand, I think the other thing that I've heard is that the proportion of calls, when we're talking about police or EMS, even, that deal with situations that you wouldn't prototypically think of as falling under the police or the EMS designation, is that actually like a very large proportion of their calls. And so I think this again comes back to this idea of thinking about what function do we want each of these occupations to fill, and how are we using people in the most efficient way in order to address these different issues.
So to touch on something that both of you just said around, learning and kind of the piloting and learning, what would you say to community members that would say, the urgency is now? There's not enough time to kind of take it slow when, sometimes life and death is on the line, is how they would frame it, right? And so is there, should we just go in full force and, the chips land where they may, or, or is it a delicate balance of, you do a pilot and you scale up, and another pilot and you kind of keep growing that way? But what would you say to that community sentiment?
I think that the tension is that people think they're going to get to a perfect solution from the beginning. And I think we need to all get more comfortable with the fact that there is no perfect solution to these problems. So, in terms of the scale, I think it's less about the scale and starting small, and more about, how are we designing these processes, or, with, again, like time to learn from what we've tried and iteration to improve based on what we've learned. I don't see a lot of that in the solutions a lot of times. And I think that that's, again, when there's no perfect solution, you have to be constantly learning and trying new things to evolve, right? And then the problems are going to evolve too. So we have to figure out ways of responding to the problem that are much more agile, and that we can change as quickly as, society changes. I think watching what happened with COVID was fascinating over the last year, because it just forced so much change on people so quickly. But a lot of people rose to the occasion. A lot of businesses changed on a dime, and so we do have the capacity to change quickly if the urgency and the need is there.
And I think to that point, another opportunity maybe is, I think Amanda was speaking to this earlier, of these connections between these institutions like the police and healthcare and other services and organizations out there. I think building those connections could be a way of scaling things more quickly, because you're basically leaning on this infrastructure that this other organization has created already and is already running. So I think that might actually be one of the ways that these things could be scaled more quickly.
Amanda, I'm not sure if you wanted to weigh in on this one.
I was just going to talk about, so April brought up COVID and the rapid response by some of the organizations that are fascinating. And again, in my region, there is I won't say the name so I'm able to, but there's a collaborative. The place used to be just a drop-in center where there was meals served, there was a pantry, there was bathroom services. But as a result of COVID, it has become a collaborative. There's multiple agencies now operating out of that building. So there's still meals served 7 days a week. There's still the pantry, but now it's evolved into there's shower services, there's safe sleep beds, the mental health is there, social services, harm reduction. A lot of the agencies came together because as a whole, their agencies were not operating under COVID restrictions, but they have satellite systems now operating under one roof and it's really cool to see. I volunteer there, so I get to see it from a different perspective. I'm not there as a police officer, I'm just there as Amanda. And a lot of the clients only know me as Amanda, which is super cool because I'm seeing it from a different side. But just a lot of the, there's public health, because there's medical professionals, there's doctors, nurses, medical professionals, and the agencies have all worked together to put the best possible solution for our region, for the at-risk community due to COVID restrictions. And they did it fast, and they're evolving and they're getting better and better all the time. And it's amazing for the clients.
Yeah. I think
so Sorry, go ahead, Natalya.
Sorry. Yeah, I was just going to follow up on that. I think one of the challenges to that more collaborative approach that I see with policing specifically is that some police officers, not all, obviously, there's a component of the culture that very much sees kind of crime prevention as the domain of police officers and only police officers, and that basically they want to be very separate from other groups in kind of performing their mission. And so I think that has been something that in my research at least has been, I could see being impeding police officers' ability to kind of follow these more collaborative approaches.
So coming back to where we started around the response, the ways that systems were able to respond to COVID, which, as April said, and both of you, Natalya and Amanda, have said, it was surprising to see how fast and how flexible systems were able to be, and particularly from an identity standpoint. A lot of times the systems had created an identity that seemed like it was rigid, and then we found out that maybe they weren't as rigid as we thought all along. And so, what has that taught us? The ways in which systems were able to be flexible. What has that taught us about our understanding of the systems? And and what does this mean for for these identities that have been created, where folks have said, we can't do this and we don't do this, and then suddenly we're doing it, and there's no question asked because we're forging ahead. What do you make of all of that? You can start with you, April.
Oh, don't start with me. I'm still thinking about it. I'm not sure. Somebody else can jump in.
I can jump in if you like. Yeah, I think just the biggest takeaway for me has been that an emergency can bring us together. But I think the larger question there then becomes, how do we get everyone on board to perceiving something as an emergency? And I think that COVID is one of those rare things where, I mean, there is still disagreement about whether COVID is an emergency among some groups, but there's been a larger perception that it is. And I think that's maybe a starting point, is how do we bring people on to seeing something as an emergency?
Yeah, I think I think that we have the ability, it gives me hope, right? It gives me hope that we can make changes, that we can think creatively, that we can solve problems in new ways. And we all, I think, needed a big kick in the pants. Maybe COVID was too big of a kick, maybe a little too disruptive, but I do think that, even though COVID's been really hard, it's pushed things in new directions, and I'm so happy for that. So I'm hopeful for the future, thanks to COVID, surprisingly.
Amanda?
I was just going to bring it back to something Natalya said. Back around to identity again is a big portion of this. When Natalya was talking about some of the officers, or the majority, I'm not sure what word you use, Natalya, in your collection, in your analysis, was officers seeing it as crime prevention. It has to be the flipping the focus to crime prevention. Will actually have, there'll be ripple effects if we all start working together under the whatever various confines we have to operate under. Crime prevention is going to happen at the grassroots level when we're all working together in a better way. And then the officers are super focused on enforcement, and crime prevention can get the bigger and badder people, and we can help address a lot of the issues that are causing criminality by having all the agencies working together in partnership and collaborating to provide the resources and the services that are sometimes lacking when going back to our silo concept. So I'm excited too, but what I've seen in my region with the agencies coming together to work with the collaborative for where they've all got their satellite systems operating under one roof. And now it's just a matter of the police working better with them and moving forward.
Sorry, Amanda, you made me think about COVID And I think maybe one of the things about this last year that has, like, the reason why things have been able to change and that there are these new solutions being created is because it provided us all with some focus and priority. Again, going back to, like, you know, police officers can't be everything to everyone, right? Like, we all kind of rallied and focused in on this problem. You know, it's not over yet. We didn't solve everything, but it's a lot better now than when it was when it first started. We got a better handle on it. So focus and priorities. What a surprise.
So is there, you know, now that we've seen, you know, the possibilities of how the systems have been able to change and work together and better integrate, you know, once everyone's been vaccinated and, you know, schools are open again and all of that, is there any going back? Is it, you know, people say, you know, we can't wait to get back to normal, or is that done? Have we moved as a society past, you know, the way that the world was, you know, the axis that it was spinning on? We're not necessarily going to do that again. And as you said, April, there's been new pathways that have been opened. And so this is just an open question for all three of you. What happens after this? Do we go back to the ways, you know, back to our system norms and cultural identities? Or is this, you know, is it a brand new world that's ahead of us?
That's a really big question, and there's so many facets to it. I don't see that we can go back. And as far as policing, for just the collaborations we've seen, the progression that police agencies have made, but also, and this is another gigantic topic, so I'm only going to touch on it very briefly. We have to change, and we have to be progressive because there's decriminalization of drugs. We have provincial mandates for community safety engagement plans that the police have to evolve and change. So I don't see that we can go back ever due to COVID and changing laws and changing provincial mandates, which for me is super exciting. But like I said, it's a whole nother topic. I just don't see how we can ever go back because we have to progress forward. COVID's proved that we can work together and it can be done quicker. And then with mandates, laws and regulations changing for police, I'm not sure for public health, I'm sure they're changing as well. We have to evolve. And like I said, I'm excited by that. So that's me as a person, but I think we have to change.
And I think some of the changes that are in place, the ball is rolling on them. And it's going to be, in some cases, be harder to stop those balls than it is to just continue with that momentum. I know I've heard out of BC, at least, a lot of harm reduction efforts by Dr. Bonnie Henry because of the opioid crisis that basically spiraled even more out of control since COVID started. There have been safe injection sites opening that are not necessarily fully sanctioned by the federal government, but it's part of this emergency response to the kind of situation we're in. And I think, yeah, as I said, now that those balls are rolling, it's going to be hopefully pretty hard to stop them.
Yeah, I think we have a lot of problems ahead that we don't even know about yet, right? Because of COVID. I mean, we're not through this yet. We've all been trapped inside. It's going to have a mental health impact on a lot of us, and what that looks like moving forward, I don't think we know. So I don't think we can go back because there's just going to be new challenges that are unfortunately out there that we're going to have to figure out.
Well, thank you. Thank you all for that. I'm looking at the time and we're right at 6 o'clock. And so we can keep going, but this is a time now where we want to just open up the chat. So if any one of our attendees has a question, feel free to pop them in. I'm just looking, I don't see anything there right now, so we can keep going. But again, if you have any questions, here's your chance. So here's a question for April. This will probably be your favorite question. It's around design. So, in a world where, systems are flexible and we can integrate, and it's not a challenge to be able to do kind of interagency, cross system collaboration. If you were to pick an issue, any kind of public health issue, what would that design look like, kind of from end to end? If all of the partners were aligned in doing everything that they were supposed to do, and the engine was firing and the train was going, what would that look like? What would the issue be, and what would that look like, that design?
So I can't design that in the time allotted. But what I will say is that, one of the principles of system design is to design for failure, right? And acknowledge that the system will fail, and that you have to, figure out a way to recover from that failure. And so I think, that's just something that needs to be in these, like, again, there is no perfect solution, but when something goes wrong, do we have a way, again, to learn from it, to address it? And I think that really should be one of the areas of focus. But I'll think on it, and maybe next year's panel, I'll have an answer for you.
Natalya?
Yeah, similarly, I don't know if I can map out an entire system right now, but I think one of the opportunities that I do see when we're thinking about change and adding flexibility and adaptability in is just connecting change efforts to the core values or the existing elements of the existing identities associated with these occupations. Because I think there are obviously parts of those identities that are really, really valuable. We don't want to lose that. And I think that can be a catalyst, actually focusing in on those valued aspects can be a catalyst for making change less scary and increasing acceptance of it by the people who really need to accept it, being the members.
Amanda?
That's a lot. I don't know what a perfect system would be, because again, you got to look at the humanity of every single individual member of your organizations and buy-in. And a lot of the work is going to be done by your grassroots, your ground level officers, and that is the majority of your organization. So it's all going to be dependent on education. People learn by watching, and it's a human connection as well. So by human connection, you can get buy-in. So some of this stuff may be mandated, and maybe what we have to do as police officers, and it would come from the top down. And that may be the only way you're going to get some members to do it. But contagion, as it grows and enthusiasm grows and we start seeing results, you may get more buy-in. And again, for me, it comes down to humanity of individual members, as in being either you're told you have to do it or you're doing it because you want to, or it actually just becomes part of our job and you accept it and move on. And I think that it would be cool if we had, like I said, my service is progressive. So it's just, again, getting the leadership to, under the regulations and mandates and policies that we have to operate, and under laws, provincial and criminal laws that we have to operate under, come up with the creative solutions. I don't know what they are. I have lots of ideas, but I don't know. Would take forever. It would be a very long session if I started rambling on about my ideas.
So just to unpack a bit, something you said, April, there just stuck with me around systems have to be willing to fail. And what does that mean for, for public health, for law enforcement, where, these are institutions where society has entrusted a great amount of authority in these bodies, because oftentimes these are conversations about, health and well-being. Sometimes it's life and death. Would, are we as society prepared to have this conversation that failure needs to be a part of the design when, the stakes are so high?
Yeah, great question. I don't know if I really have, I mean, I don't know if we're ready. I mean, I think we're starting to be ready, right? Like, defunding the police is right about acknowledging that something has to change because we are seeing a lot of failures right now. And, expecting police to be everything to everyone isn't working anymore. So I think we are kind of acknowledging that the systems have failed and we need to think differently about it. I think we're going to, again, like we're going to have to move to a problem-solving approach that acknowledges that there is no perfect solution, which, inherently is saying that it's going to fail. And I think, we just need to spend a lot more time understanding the problem before we're jumping into it, because it's complex. And there's a lot of different stakeholders and angles to it. This is a tough one. I don't think there's any right or easy answers. But I do think that even just in this conversation, having a designer, an academic, like a police officer, right? Having this diversity of perspectives will lead us to better solutions. And so that's something else that I'd like to see is, inclusion of lots of perspectives and not just optimizing for one perspective.
In thinking about from the public health aspect of this conversation, thinking about vaccines and a lot of conversations lately around vaccine hesitancy amongst marginalized populations, which are also very susceptible to contracting COVID, and wondering, there's so many similarities between law enforcement and public health in this aspect, and what is the public ready for? What are marginalized communities ready to kind of accept? What is their understanding, their experiences, and then how does that inform the way in which they access services? A lot of folks don't understand why there's vaccine hesitancy, but for those communities, it's like, why would I trust a system that has not responded to me in the past? And so, just in thinking on, how that translates between law enforcement and public health, and the way in which different communities see and respond to services, and what would success look like? And I'll open this up again. What would success in systems working together, in communities accessing services and feeling trust in these institutions? What would that how should we define success in that sense?
A big portion of that for me is bringing people's lived experience to the table. So you have to have the right people at the table. So if you have high level discussions happening all the time, and you're not actually incorporating and including the people who are going to be accessing it, those with lived experience, those who don't have trust in the system for various reasons, and acknowledging them, letting them have a voice. You cannot design a system that's going to bring the people who need it the most in, because you're not including them. And it goes back to discussion I was having with a friend this week about doing things to people as opposed to doing it with them. It's a big difference when you're just making it happen instead of making it with inclusion and making someone feel valued and respected and that their opinion matters. So it's opening up those discussions and including the people that you're trying to help. Otherwise, it's when we're talking about setting stuff up for failure, you're setting everyone up for failure if you're not including the very voices that need to be heard.
Absolutely. I could not agree with that more. That's so important. I love that. I think that is fantastic. So I agree what she said.
Natalya, did you want to weigh in?
Yeah, I mean, I think it's hard to follow up on Amanda's point because she hit the nail right on the head. But yeah, I think just from the academic literature, at least, it seems like the more you include people in these critical decisions and in system design, and surprisingly, the more committed they are going to be to those decisions and systems. So how, again, are we kind of bringing those people in so that it doesn't feel like it's being forced on them, but that they're part of the movement itself?
And how do systems bring folks in, as Amanda said, the ones with the lived experiences? Because typically you see that systems are designed and even in the design, they don't know how to reach those folks, how to engage those folks who are most impacted by what the system is trying to design. So how can systems do a better job of being more responsive to the people most impacted?
That to me speaks volumes about leadership. Sorry, where I'm sitting, the sun keeps shining in my face.
You look great.
Thank you. That speaks to leadership. If your leaders need to know the people in your organizations, because you're going to have people in your organizations who are going to have relationships already formed, be it with the agencies or the people with actual lived experience. And I know for me with my harm reduction work and just the volunteer work I do, this is not me being special. There's a lot of officers like me. We know people on the streets. We have actually relationships that go beyond just I'm going to arrest you. It's professional relationships. For me, I'd even go so far as to say as friendships with people with lived experience who are dying to get invited to that table, and different community members who would love to be at that table. They're just waiting to be invited. So if the leadership, who are generally the ones making these high level decisions, know their people, you're going to be able to get the right people at the table, because you just have to open it up and have your members identify people who want to be there, and the tables actually to be flooded with the people you need to be there.
Yeah, and I think that's just another reason why hiring efforts need to be targeted towards creating a diverse employee group, because I think we're assuming that there's the employees of these systems and then there's the people that are distrustful of these systems, but sometimes those two groups are overlapping. And I think that is one of the ways that we can really integrate the perspectives of all sorts of different people. Yeah.
Yeah, I would just add that, you do have to kind of audit the relationships that you have with those communities, and go back and understand, again, going back to like, you really have to understand what the problem is, right? Really understanding, the breakdown and acknowledging it, and rebuilding that trust somehow takes a long time, and it's difficult, but showing, being persistent, and not giving up, right, shows commitment and shows caring and helps rebuild trust. I think, there's a lot of different ways to rebuild trust, but I think you have to understand why that trust is kind of broken in the first place.
And the understanding is going to come with having real discussions, real conversations, and honest conversations, and being able to be open to the fact that your organization has probably failed people along the way, be it organizationally or your individual members have really hurt people or failed them. So having those honest conversations, hearing what people have to say, and then being transparent about what you're going to do about it. If you can't do anything about it, be transparent, but you also be accountable. You can't have those discussions if you're not willing to do everything that it takes to ever repair that trust.
Wow, so much in so much in in what was just said there, just around, from hiring to, making sure that there's a diversity of voices, and, sometimes the overlap between the issues that employees feel versus, employees of a system, or members of a system, and how they might be feeling the same issues as, a community that's distrustful. There's so much, and I think this is where systems, institutions struggle at times, and like you said, Amanda, that transparency piece in hearing those voices and being transparent and, opening up the system to show, where all the warts and flaws are, for someone who's not a member of that close-knit group, who hasn't gone through all of the everythings that create kind of an institutional identity. That hesitancy sometimes to really open it up and to be judged and assessed based on what somebody with a completely different lens would see, and then what they would take away from what they're seeing. So it's an interesting space to work in when systems are ready to take that next step, because there's a lot to unpack generally, and a lot of pain a lot of times in that unpacking.
I think that's such an interesting point too, because I think a lot of times when organizations are thinking about the risks that you're talking about of opening themselves up, they think about the risks of doing that, but not the risks of not doing that. And those actually might be the greater threat to the organization at the time, but it's not the way that we typically think about risk.
Mm-hmm.
I think that brings us back to what this whole session is about, is identity. It's your personal identity versus organizational identity versus cultural identity. I mean, Carl, I'm saying police culture in general as a stereotypical phrase to use. There's different identities all within one big organization. And so it's getting those two to mesh in the best possible way to serve the public and to have the best outcomes, and getting rid of some of our very old traditional values and views that organizations are holding, and moving forward to where we need to go.
As an example, at the Toronto Police Service, we have a committee called the Police and Community Engagement Review. It's the PACER team, and when that team was starting up, the service opened up everything, the policies, the procedures. Community was brought into some some of the most intimate discussions that typically take place behind closed doors with police officers, and it was a difficult process, but the work that came out of that, like you said, Natalya, like the risk of not doing that at that juncture in time, that work that they were able to produce is it's considered legacy work. Because the service had to get there, right? And not everyone was there, and some of the leaders are there, and the leaders might be there, but sometimes the folks coming up behind them aren't quite there in their leadership journey to understand why that's important, and working through what all of that means, and community members feeling like why am I doing this if nothing's going to change, and having to come to the table and have those discussions. But like I said, what has the pain that was for 1 or 2 years, 3 years, and probably 3 years, the work that's come out of it, has been so key in shaping how the organization now starts to change.
Yeah, and I think that also speaks to this idea that we've been talking about the risks, but maybe not perceiving the benefits of doing these things as well. So it's on the negative side of things, but also on the positive side of things. Sounds like there's some real gains that came out of that risk taking.
Mm-hmm. And other times you see institutions that are not quite, that want to have that openness, but are not quite ready for the risk. and what that means in terms of what that creates, or how that can lead to creating more distrust in the system if it looks like it's just an exercise, but it's not a legitimate openness and willingness, because that openness, as we talk about cultural identity, that openness is just not something that comes naturally, whether it's in policing or or in public health, because you have people's health in your hands. It's a difficult proposition to say I don't know when somebody needs help. It's difficult to be able to say that, especially when they're coming to you in such a vulnerable state. So I'm not sure if you had any final thoughts on that, but we are coming up to the end. I don't see any questions in the chat, so I'm going to ask you each to spend a couple of minutes and just kind of summarize your thoughts around systems and what we've seen, what we kind of have always understood about how systems function, and how personal identity and kind of institutional identity intersect, and then how all of that was blown away when COVID happened last year. And all of our understandings on how things can work we're now in a totally new landscape. If you wouldn't mind touching on that as we wrap. April, we'll start with you.
Sure. I guess I just would reiterate, let's be positive. Let's look forward to the future. COVID's given us a big kick in the pants to make the changes that we need to make. And we need to make them on the public health side and on the law enforcement, police side. And, we just need to remember to really understand the problem that we're trying to solve, really figure out what the outcomes are that we want, and develop creative solutions that are, inclusive, and that are developed with, lots of diverse perspectives along the way, lots of iterations of learning and solutioning.
Natalya?
I guess the biggest takeaway for me from this conversation was just something April said about designing our systems with the expectation of failure. I think that's a really powerful idea to take away, and to maybe connect it to some of the things you were talking about just now, Danielle. It seems like there's a big risk to building in this expectation of failure, but the opposite of that is not tinkering with the system at all. And that seems like a bigger risk at this juncture. So I would just leave that with the audience. How can we be more accepting of that?
Amanda?
Kind of tough to follow both of you because you're both making great points. Takeaways for me is just, as a police officer, we still have to operate under policies, procedures, directives, criminal law, provincial law, oversight from different boards. If we screw up, there's complaint processes, there's the SIU. So there's a lot of things that we as an agency have to operate under, but it's how do we do it better under the confines, and how do we do it progressively, because we can still accomplish a lot with systems and changing systems. And like I talked about quickly, just what my agency is doing with mental health. I've been a police officer for 23 years. I never would have seen that like a couple of years ago. And now the agency is operating under the system with all the rules and regulations, but doing it in conjunction with public health, so with the hospital, the nurses, and doing it for the betterment of everyone. So there are ways to, going back to our workaround, it's not really a workaround, there's ways to provide and design better systems for the betterment of people and still operate under the confines. So that's exciting. And just listening to everyone talk it's interesting for me. Even the concept of failure, what is failure to other people? Failure to a police officer in a life and death situation could actually be death. So for the person or for the officer. So it's just being cognizant of all facets of system change and what police organizations and public health organizations, risk and liability, they operate under. So just be aware of what we can change, and there's a lot we can change, and just doing it better and doing it safely for everyone, and including everyone at that table. That's my biggest thing, bringing the right voices in.
Well, thank you all so much. That was I've personally have learned so much from this conversation, and there's so much for me to take away. you know, we're at such an interesting time and space, you know, within the pandemic, within law enforcement, within public health, and how all three of those things can and should work together, and what those possibilities are. On top of that, married up with some legislation, new legislation coming down the pipe, which before COVID was going in this direction, but the timelines to really get it done has collapsed. And so that, you know, that urgency to be able to move quickly and more integrated together is wonderful, particularly for you know, all of us here who in different ways this has been so critical to the work that we do. You know, how do we work, and how do we work integratively and collaboratively with different systems? So despite you know, the devastation that COVID has brought, there also is this other aspect of, you know, there's a new pathway forward that we don't know yet. But it's an exciting pathway, right? And we'll get there together, and we don't have a choice. And you know, it's I think what will come of this is wonderful. So I just want to thank the three of you so much for the insights and the perspectives that you bring. Thank you for the work that you do. Here comes my daughter. Okay. Thank you so much for this conversation. It's been really wonderful, and I hope that those tuning in got a chance to hear a variety of perspectives on an issue that is so contemporary to our time. And that's it. So thank you so much, ladies.
Thank you so much, Danielle, for fearless leadership and guiding us through this conversation so thoughtfully. It was great.
Thank you.
Also, can I say my email? If anyone's listening, I love these discussions, and I always want to hear what everyone else to say. Is our emails getting put up, or contact info?
Yeah, why don't we put them into the chat? Does that?
Okay. Yep.
All panelists and attendees.
And all attendees can message you through Whova too.
Okay.
So I just put my email into the chat. Please let me know if you have any questions or you'd like to talk to me about anything.
There we all are. All right, it is 6:28. We finished with 2 minutes to go, and now I've got to get dinner going. It's leftovers, so it's okay. It won't take long. Thank you all so much. Have a wonderful
thanks
evening.
everyone.
Bye. Thank you, everybody.
Thank
Bye.
you, and thank you, Eli, for your tech support.
No problem.
Thank you.
Bye.
Bye.
Great job, everyone.
Bye.